Go.
All right, hi everyone. We're here now to do our practical assessments. I've got a few stations set up, so I'm going to show you everyone what we're going to do, and then we're going to take it in turns. So we're going to start with making a bed and giving a patient a bed bath. So this is our patient, meet Big Ted. Now, when we're doing a bath, we try to maintain
Composure.
our patient's dignity at all times. So we use towels to cover up. Okay, now we usually we've got 2 flannels here, so this is our bucket of water. We've got our flannels, always start with the face, be gentle, you don't want to poke their eyes out. So gentle wipe of the eyes, and then do the mouth. And then the nose. And then we can proceed to do arms and hands. And usually you'd be working in pairs. So would you like to stand up and give me a hand here? Okay, so what I'm going to ask you to do, we're going to roll the patient onto his side so you can wash his back. Okay, so to safely roll someone onto their side, we bring the arm across and knee is bent. And you put on shoulder and knee, one hand on shoulder, one hand on knee, and gently roll towards me. That's the way. Now I hold knee and shoulder. If you want to grab the cloth, give our Teddy a bit of a wash of his back and his bottom. Yeah, oh no. Okay, now you're going to use your towel. Just give it dry. The way. And now you gently roll the patient back. And now we're going to roll the patient towards you and knee and gently roll. And I'm going to wash the patient's back, bottom and leg that side. And then roll the patient back. Now one thing we do have to do to make sure we use proper manual handling techniques is the height of the bed. Thank you. All beds are adjustable and usually adjust them to the height of the waist of the shortest person. It doesn't work if you've got someone who's 6'6" and someone who's 4'9", but we do what we can, I suppose. So now our patient has had his bath, we would go ahead and change the sheets. I don't have any sheets on, but this is how we would do it. I would take the sheets off the end, and roll them up into a little ball like that. We would then roll our patient, if you want to help, onto his side, if you want to hold, and you'd continue to roll and tuck it right up under there like that. We're holding the patient there. I would then get the new linen and half make this bed this side here and tuck it underneath the old linen. Then what we would do is we would roll the patient back towards me like this, and you would pull the old linen out and then make the bed using the new linen as such. We would roll the patient back, cover our patient up, and now our patient is bathed and has clean bed linen. Alright, that's station number 1. Station number 2, if you want to follow me into the kitchen, I'm going to be performing a shave. So I've got my razors here, and now for safety reasons, you're not going to be shaving each other. You're going to be shaving balloons. So we've got a balloon. Got our shaving cream. So what you do, you don't need very much because it goes a long way. Put a little bit on your fingertips. Get a balloon. Just smear a little bit on. As such. Rinse off the excess. Now with your razor, make sure the cap is off. all we're going to do, you're going to cradle your person's face and you're just going to shave the shaving cream off the balloon. If you pop it, you lose. Insta fail. No, I'm just kidding. Just try again. That's the next station. Now the next one after that is, if I could use you, Matthew, for a hand here, I'm going to get you to sit in this chair for me. And I'm going to blindfold you because you're blind and you can't see. Is that too tight or is that okay?
Nope, that's good.
How do you think you would feed someone who is blind?
By talking to them.
Absolutely. Communication is key.
Yeah.
You would ask them, hey, how are you today? Are you ready for your meal? And you can get the damn thing open.
Yeah, right.
It's usually not this complicated, I swear. Now, one of the safest ways to feed someone who is blind is, other than talking, you'd be sitting in your own chair, but you tell them that the food is coming, it's on its way. And another way is to just touch it to their chin. So then they open their mouth and they eat their meal like that. And then they would verbally say, I'll finish that mouthful. And then you touch the spoon to their chin to give them the next lot.
Okay.
Okay, so that's station number 3. Now, if we go into the lounge room,
Where are we going now?
we are going to be transferring out of a chair.
Oh, man.
Doug, would you like to have a sit for me? Okay, so we have to make sure we maintain our posture because we don't want to hurt ourselves in this. To assist Mr. Jones out of the chair, just put a hand on his shoulder, lean forward a little for me, hand in the middle of the back, and ask him to push off from the chair using his hand. So would you like to push yourself up? And as he moves, take a step forward, support the shoulder and the upper back. That's how you transfer out of the chair. Now, if we were to transfer him into another chair, so if you just want to come and sit in this chair for me, transfer, say, to a chair or to a bed, we do the same thing, shoulder, back, if you want to push up from your chair. Excellent. Now we're maintaining support there. Get that one out of the way. Maintaining support, you'd ask to turn. So if you want to move your right foot and then your left foot, and if you just want to shuffle back a little bit until you can feel it behind your legs, excellent. You can push your bottom back and you can sit. Transferring to a bed is the exact same way. So when they spin, you help them lift up their legs. So if you just want to spin as if you're lying down, then you'd assist to lift up legs. And that's how we transfer like that. Transferring out of a car is the exact same way. So we're going to practice this, and it will be transferring from a bed to a chair and say out of the car as using the stand up. Okay, now one more station is going to be falls recovery. So Hayden, if you want to come here, just come into the middle here for me and sit down on the ground because you've had a fall. Okay. Now, first thing you want to do, are you alright? Are you injured? No. No? Are you alright to stand up and sit in the chair? Okay, so this is what we're going to do. We're going to bring the chair to the patient. I'm going to ask him to shuffle on your bottom a bit closer to the chair. If you could put, so come side onto the chair. Now, are you alright to get onto your knees from that position? Okay, so if you want to get onto your knees. And then using the chair on the front on, use the chair to push yourself up and shuffle back around and sit down like that. And then you do your assessment. Are you okay? How did you fall? And check for bruises and any injuries. So that is how we do a falls recovery. So now, who are we going to partner with? Are you with Mum, Matthew with Doug?
Yep.
All right. So if I could get Matthew and Doug doing the bed, and Hayden and Patricia, if you wouldn't mind starting over at the shaving station.
Okay then.
I've fucking forgotten that.
That's okay, we'll walk through it. So Matthew, you're here helping Douglas.
There you go.
Right, this is weird.
Yep. So if you want to start with that one and the shaving of the balloons. So yeah, pull the blanket back, use the towel to maintain dignity. Start with the face, hands and feet.
Yeah, right.
Just that one small area. Is that all right?
Yep, just one small area is fine. Now remember, the skin of the balloon is like skin, so you don't want to be too rough because skin does rash, especially older skin. So be gentle and don't do it flat out. Just do it nice and slowly.
Back and butt. Yep. You enjoy that too much, mate. Out the other way. Wash up.
It's good. Good technique. Yeah. Excellent. Good work.
Too much on.
Excellent.
New one.
Yeah? Are we good?
New one. Hold it.
Too much on. Yeah, we
Pull it out and
See?
pull it on.
that good?
Yes, that's great. Well done. Well done.
Okay.
So if you just
Oh,
You're up.
I'll wipe myself.
excellent. Good work. Good work. All right. Now swap.
I think Doug wants a job. I lost my job.
What? Okay.
Keep nappy off.
On my hand.
Did you clean it up?
Okay. Hey. So who's doing what?
Yep, that's it. So you working on one side. Remember to use the towel for dignity. Start with face, hands and feet.
Face, hands. Using Cohen. Like that. Yes.
Both do it at the same time.
Okay. Now, when she said wash and then that. Okay. Now, what about the front? That doesn't.
Yes, yes, you certainly do have to do that. Remember to maintain dignity. It's all about dignity. So you'd pull the towel up from the bottom and do it that way, and use the sheet if you need to.
Okay.
Then now get back.
Yeah, we've got to bring those things out. And then it's knee. And knee.
Now when we finish with
Just wait until these guys are finished. Good work.
Nicely. Wash this. Back. Make sure they're dried off. And then bring this sheet up.
Remember to take the towel off him.
Yeah, yeah.
Oh, sorry.
Yep.
Excellent. Good job. Well done. All right.
Roll and change the sheet.
Oh, yes, yes, sorry. I didn't realise you hadn't done that. I'm sorry. So take the blanket down. That's it.
You take the dirty linen off and roll it.
A good tip is to tell your patient that when you roll them back, they're going to be a bit of a bump in the middle of their back, because if you could imagine rolling over rolled up sheets, it could be a bit uncomfortable.
under the other one.
Yep.
Like that.
Okay.
Roll that.
Roll that one back.
And
Arm over.
roll like that.
Pull the bottom one
And
out.
out. And the other one through.
Excellent.
And roll them back. And
Beautiful work.
clean sheet.
Well done. Make sure our teddy's nice and comfy. Excellent. Okay, so Hayden and Patricia,
Yes.
if you want to start doing the chair to bed transfers
Okay.
or chair to couch,
Okay.
and Matthew and Doug, you're going to be feeding each other.
Can I watch?
No. Well, they're going to be anyway, so.
Alright, sit your butt down, boyo. Yeah, I wasn't watching the so I'm not sure.
Okay, so would you mind standing over there, and I'll demonstrate it again. So if you want to sit in the chair for me, what we're going to do is...
Am I
transfer
recording
you-
this?
Yes, it should still be recording.
Yeah.
So we're going to transfer you from this chair to the couch bed. Okay, so now to do that we need to we've got to look after our backs. So in aged care especially, your back will be the first thing to give up on you if you don't treat it right. So we need good posture and correct manual handling skills. So if I'm going to assist him to stand, I want one hand on his shoulder.
Alright, Matthew,
Lean forward a little for me.
I'm
And
coming
one
in
hand
with
just
some
in the
jelly.
middle of the shoulder blades. So if you want to push off from the chair to stand
Are
up, now I'm going to take a
you
step
ready?
forward as he moves. Now I've got good control, but he also needs to have good balance. So now I'm just going to move the chair.
Get it up.
Now we're going to move over
Are you finished?
to the bed there.
Yep.
Now if you just want to go slow, don't go too quickly. Now can you feel the chair behind your knees? Now push your bottom right back and sit. Now as you lie down, I'm going to swing your legs up for you. So if you want to come down that way, I'm going to swing your legs up for you if you want to lie down. Now if you ever need to get down lower, use your knees, not your back. Now that's all I want you to do.
Okay then.
Alright. You better
Mm-hmm.
Matthew.
Okay.
Coming in with some food.
So who's doing?
Are you ready?
So, you first.
Oh, alright.
Here it is. Okay.
Yep.
And you know when you're
Alright.
finished?
So now,
Finished?
I've got to hold on
Excellent.
One
shoulder.
shoulder,
Put your one
middle
a
of
bit.
my back.
Back.
No thank you. You're not hungry anymore.
You've had enough to eat. Fair enough.
Okay.
Shuffle across.
Across.
Turn yourself around. So we got legs touching the ground.
Now you got to feed Uggy Man, Matty.
Okay. As you lie down, I'll grab your
Bench
legs.
from your
You
knees.
fucking get-
Yep.
That's
As
it.
you lie down,
Don't
I'll
you
grab
get
your
that jelly on my white
legs
shirt,
up.
son.
There
We're
we
doing
go.
all sorts of
Excellent work.
Blanket for you.
Excellent work.
Well done. There we go.
You do this or do you want me to?
Now, what I'll get you to do is get you to sit up, and you can help her stand from the couch because that's similar to getting out of a car.
Same thing, so one
Green,
on the
thanks,
shoulder.
mate.
Yes, and remember, bend your knees, not your back.
Oh, fuck it, just give me the orange.
Language.
Okay.
Oh, sorry.
And shuffle yourself across towards the chair.
Yep. Until you can feel it behind your knees. Reach behind you.
And you grab the chair.
Some jelly.
Excellent.
There we go.
Well done. That was really well done.
Right, there we go.
Now, have you both had a turn at that?
No.
No? Right,
It's
spot.
my turn.
Want some more?
And
My
Yes.
turn.
I would like another, please.
You alright?
Yeah.
Okay, coming in with a second lot.
So this is going to be interesting. And on the
well done.
shoulder,
Good technique.
on the-
Well done there, Matthew.
push yourself up
One more.
and four. Okay,
Okay.
now shuffle across. Shuffle across down so that you can feel the couch behind your knees and just put your body
Any more?
sit.
That's it.
That's all, thank you.
Yep.
I'm nice and full.
Good work. Well done. That was really well done.
I'm going to help you with your legs. Okay?
Yeah, we'll
Excellent. All right. Swap.
Oh, okay.
There we go.
Right, stand. Blah. Not you. Darling.
Okay.
So we're using this one as a blindfold.
Yes.
Yeah. And
Are
just
we using the different spoons? Or?
yes, yes. And pick a jelly or a mousse.
Standing up.
Which one do you prefer?
Move forward. Can you stand up for me?
Push up from the chair.
From the chair. Push up from the chair with your hands. Yep.
That's it.
Stand up. Excellent.
There we go.
Now you're going to shuffle across to the couch
Across to the couch.
and turn around so you can feel it behind your knees.
I'm gathering your feet.
Yes.
Shuffle back so you can feel it behind your knees. And sit down.
Prepare.
Excellent. Good technique. That was great. Well done.
Okay,
Just
blindfold.
down.
Have you ever been blindfolded in your life?
Yep,
You have.
yep. When you play games called Blind Man's Bluff when you're a kid. Yep.
Nice recovery there. Keep it PG rated, people.
Right, that's good.
Right.
Yep.
Now you come down
You
here.
have to explain it.
Pretend you're-
Oh, we're not doing falling yet. That's after. Yeah.
While we're doing this.
Just as you're coming in, remember to touch the spoon to the chin.
Yep.
And that's it. Just explain what you're
What
doing.
do you mean? Touch it to the chin. Right.
Okay, so get your jelly on your spoon.
Small amount.
Yep, small amount.
Let's see.
Okay.
Say I'm just coming in with the first spoonful.
Okay, coming in with first spoonful.
Touch the tip of the spoon
There.
just to her chin,
Yes.
and that'll encourage her to open her mouth so she knows where it is. And there you go. And now you have to. She'll let you know when she's finished and she's ready for the next mouthful. Excellent.
Yeah. Okay.
Good work.
So I can get it on there. Without it. Okay,
Mm.
coming in.
That's the way. Excellent. And swap.
What? What?
Hey, you have to feed Hayden now.
Oh.
We should make it interesting.
Mum
leave
liked the
blindfolded
jelly.
you.
Oh, you can have the jelly.
We should be both blindfolded. That'd be interesting, wouldn't it?
No, well, blind leading the blind.
Yeah.
In fact, that made for a hell of a game. You should probably not wear a white shirt.
That's okay. So while you two are swapping, if you two would like to start on Fool's Recovery, that's okay.
Oh, gee whiz, you're all stacked and stuff.
Oh, stuffed and stuff.
What? You right, Matthew?
He looks like he's going to have a rest in that bouncer.
So ask him if he's okay.
Hello.
Hello.
Are you okay?
Yeah.
What
That's
seems to
all
have
right.
happened
That's
here?
fine.
Tight.
No, that's good.
Fall off
Okay.
the chair. Fall off the chair.
Okay.
I'll
So
just do the
if
same
what we want to do is we want to bring the chair a little bit closer to you and get you to just sit on your bottom. Sit flat on your bum, straighten your legs out.
Straighten your legs, yep.
And that's it. Now put one arm on the chair
Put one arm on the chair.
and come up to your knees using the
Can you
chair.
get to your knees using the chair?
That's it. Now using the chair, bring it to the front. Use both hands.
Use both hands.
Pull yourself up.
Pull yourself up. And
Excellent.
Next one.
Good work.
no more easy.
Yeah.
Would you like any?
Good work.
No, we're good.
Now
We're good.
let us swap.
Okay.
I'm full.
All right.
Ah,
I'm not a big eater.
no. Okay.
All right. All done.
Yeah.
Good work. Uh-oh, we've had a big stack.
Okay, are they okay? I'm okay, thank
That
you.
jelly's seriously not good.
No.
It's like rubber.
Oh. All right. So if you want to help him up off the ground, bring the chair over closer to him so he can put his arm on it and use it so he can get to his knees.
Yep. Can I get to the knees? Yeah. Or maybe.
That's it. And then front on to the chair. So bring the chair around so it's front on. And you hold the back of the chair while he pulls himself up. Excellent. Yay! All right, now
You get a sticker for
you
that.
two can do Fool's Recovery. Sorry, I was just clearing my throat. I wasn't telling you off, I promise.
Oh, crikey golly.
Yes.
Bit of good.
All right.
Ow.
She actually,
This
she's going to
this
actually
just
need
actually a
this.
real case.
So, you want to ask her if she's okay?
Are you okay down there?
Sort of.
Bring the chair over so she can put her arm on it.
Do you think you'll be able to get up on your knees?
I'll try.
Okay, there's a chair to help support
That's it.
to your knees.
Yeah.
Now turn the chair so it's front on to her.
Turn the chair so it's front on.
And you hold the back.
I'll hold the back of it. If you'd like to try and get up, then slide onto the chair.
Excellent. Good work. Are you all right there? All right. And now swap. If you want to have a try, Hayden.
Can you get up? Yep, you're all right.
Dear. Are you all right?
Oh no, what if I'm not? Like, I can't get up.
If you're not, or that's actually a really good question and one we will cover as soon as you've done this, because I have to go into that for you.
Yes, I can get up. Yes.
Are you able to put your hand on there and pull yourself up to your knees? Okay, I'll turn this around. You lift it. Yes. Well done. Well done.
Excellent. All right, so I'll let you hold that, please. Now, you asked, what if they can't get up? Which, in actual 80% of the cases, is exactly what happens. Someone has a fall, they're elderly, they're frail. It's going to happen when they fall. What do you think's the most common injury in someone who's fallen?
Broken bone.
Hip.
Broken bone, hips. Absolutely, absolutely.
Yeah.
Hip or even pelvis. What do we do in that situation? Does anyone have any ideas?
Well, you'd have to assess how serious the injury is first, wouldn't you? Like,
Absolutely.
they
So
may
you
not be
as
able
a
to get up at
carer
all.
would need to go get your supervisor, which is your registered nurse. They will come and do the assessment. Now they, with the help of the carers, if there's no broken bones and the resident is otherwise okay, but just can't get up off the floor, we would do a floor recovery using a sling and a sling lifter. I don't have any of those here. But what basically the same way of putting a sheet underneath the person when you're using the sling, and it's got attachments to a mechanical lifter. So as you attach it, it'll lift your patient up off the floor, and you'd come in with either a princess chair or a bed, and then you'd lower them into the bed, and then the RN can do another proper assessment. If your resident has got a broken bone, that's when you'd need to call for the paramedics. You need an ambulance. So you'd bring out blankets, you'd make your patient as comfortable as they can. The registered nurse would usually ring the doctor to get pain relief, because it is extremely painful to fracture a hip or a pelvis. It's one of the most painful breaks you can have. So that's what would happen in that case. And carers usually do floor recoveries in cases of non-serious injuries using slings and sling lifters. So that's what you'd do in that situation. But unfortunately, I don't have that equipment here. Now, excuse me, we do have one thing to do. Please excuse me, I will be right back. One more thing.
You're still suffering, aren't you?
I'm not going to say a word.
Taking good pictures of the
Because our poor Teddy doesn't have any clothes on. We need to put clothes on the Teddy.
Oh.
What? Can we do that?
And
Can we do that?
a continence pad.
Maybe the Teddy is a nudist.
Maybe Teddy is a nudist, but this is in the nudie colony.
Can we do that as a group?
Yes, absolutely, we can do it as a group. Absolutely. So I don't have any continence pads, so we're just going to use a towel, which works in a similar fashion. So I will. Matthew, you're already there. That's great. You're going to help me do this. Now, we would lift it from the bottom. I think we're working in other private areas. Now, most continence pads work the same as nappies do. They'll have tabs at the back that you just undo. So, when we are applying a continence pad though, because they're not babies, we would do the roll technique. So what we would do is I would roll onto the side and bring that up, and I'd tuck it as much as I possibly could, so that when a patient rolled back, you could just reach through and pull it up. And then we pull that up like this, and then you'd do up the tabs. And then we'd maintain our patient's dignity. Now, putting on a t-shirt is one of the hardest things to do when you have a patient who's bedbound like this. It is really, really difficult. So, we're going to try and do it an easier way. So I've got the shirt neck open. You'd always use bigger size clothes. Always. So if your patient's a medium, you'd use extra large for safety. So you gently slip over their head first. Now, say our patient has an injured arm, we always do the injured side first, always. So our patient's got an injured arm here. Yep, that's right. If you want to put that one into that arm. Now I'm going to put this arm in here. Now I'm going to roll my patient towards you. So I can pull that down at the back. And then you're going to roll the patient back towards me. And then we're going to pull it down there. And now our patient is dressed and has their continence pads on. Okay. Now our patient is very, very comfortable and falling asleep. And that is our practical assessment done.
Yay.
Yay. So that's the fun part. I always prefer to do practicals than written. But congratulations and well done. And I will let you all know how you go with the feedback form. And yeah, well done.